I served with the U.S. Navy attached to the Marine Corps.
The United States Air Force from 66 to 70.
I went to Vietnam and I was a forward observer with the Army near the DMZ.
I was in the Air Force.
I was in the United States Army from 1993 to 97.
4 years in the Navy and 2 years in the U.S. Coast Guard.
The former Yugoslavia Republic of Macedonia.
1968, 1969.
Omaha, Guam, and Grand Forks.
62 to 68 was my service.
I was diagnosed with ALS.
Right now I'm 100% disabled.
Veterans are twice as likely to develop ALS.
I'd fallen off a tower, hit my head, sprained ankle.
I'm on a disability for my hearing loss.
I had a little shrapnel in one knee.
Psychologically, the stress was intense.
There were a lot of bumps and bruises and things that had happened to me that weren't actually recorded.
We started Healing Warriors program back in July of 2013, and we are a non-narcotic care veterans clinic. Each of these different eras of service carries a different signature. The Korean War veterans came back with frostbite. Vietnam, you have a lot of Agent Orange.
I had a lot of exposure to Agent Orange. I was in ammo dumps blowing up with all kinds of chemicals.
In our current veteran population, we have repetitive deployment. You know, when you're going out 8 or 9 times, the impacts to the body and the mind are great. It's really critical for the attending physician or primary care provider to know that the person that they are treating is a veteran.
The idea of this being ALS was certainly something that could have been addressed much earlier. Had the doctor known about my connection to the military and also known that people in the service, veterans, are twice as likely to get it.
I had chemical sensitivities. Sometimes you'd smell something and your subconscious, whatever, would react. You'd have a reaction, but you didn't know why. So I would explain this. I explained this to one doctor, and he looked at me and he said, "You're crazy."
Most of Vietnam veterans don't tell anyone they're veterans. So there's no way that a physician or dentist or whatever is going to know that I was a veteran because of all the things that we dealt with coming back from Vietnam.
Well, I think at the time I was pretty shy to let anybody know I was a veteran, so I was kind of hiding out. So I don't think they asked me.
So one of the things that a primary care clinic might want to be aware of is when you are working with veterans to perhaps position chairs so that they can see an exit.
Veterans that have PTSD have a really hard time with being surprised or get anxiety if you're behind them.
If the individual is a veteran, we always make the assumption that there are going to be challenges there for that individual, potentially trauma-related. We always start out by asking them about their sleep because we want to get a sense for the way that this person is being able to restore and recover and replenish themselves throughout their day. Now we have a lot of our service members are excellent at managing their mental health issues. They do it by working out. Many times they are going to miss an appointment simply because they could not keep track of day and time.
When a patient is like super late, just being able to still get them into the treatment room and getting them a treatment, because it's just as important that they get the treatment.
It also is going to affect their ability sometimes to express themselves.
Anyone who's been traumatized tends to contain it within themselves, and they're lacking a certain amount of trust. And I think it's difficult to build trust. You're hoping that a professional medical person will start to build trust with you.
Usually by the second or third sessions, they start really opening up and then being able to have them express where they hurt, how much they hurt, especially on like the emotional level.
I'll go in and see my primary care doctors and they always ask, "Oh, how you feeling today? Do you have any emotional disorders?" And usually it's a technician doing it, not the doctor, and I usually say, "I don't know if I could explain that, to be honest with you."
The other piece of this is they're not sleeping, but in the veteran population, we really need to ask them, how are you sleeping? How many hours are you sleeping? We use the sleep index, and we have every single client that walks through our door fill one of those out.
I've been out of the military a long time, but I don't sleep well. I have some memories.
I have noticed significant differences in my patients that are able to fall asleep. Dreams aren't as intense that are waking them up. They're able to sleep longer. They're able to fall asleep faster when they do wake up.
If you're not sleeping and then you're also dealing with trauma and you're dealing with all other physical injuries as well, and then you're on a host of medications, this is going to have quite an impact on that individual.
With the doctor's advice and assistance, we can help get them off some of the pharmaceuticals, especially like the opioids.
There are alternatives. There are good alternatives. And a lot of it goes back to behavioral therapy, helping us learn to cope.
Our female veterans are always fighting to really get the understanding that the injuries that they suffer as well have the same validity, have the same valor associated with it than their male counterparts.
Working with female veterans is a little bit different than males. It takes a lot longer for them to open up because of the whole aspect of needing to be tougher, needing to be seen as a whole person. Just letting them know that it's a space where they can come in, and if they can voice their frustrations, their fears, and it's fine.
Communication is the biggest part of all of it, whether it's the pain management. Listen to us when we say we're in pain. Don't tell me to just get over it.
They all just want to be heard when they say, I'm in pain. They want to be treated for the pain that they're feeling and not told that the pain doesn't exist.
You're going to have instances where some of these things are going to bubble up, and understanding why and how you might handle that, I think that's important. It's just sensitivity and it's compassion.
I'll go in sometimes to primary care with a list of my questions. And before I get to the bottom of the list, time's up, and you feel the rush coming. If they could do better, spend more patient time.
At first, I really didn't understand why they were treating me in a certain way. I would go in, and at the time I had a pretty big beard. I got tattoos on my arm here, and I thought that I had a blood clot in my arm is what I thought. And she kind of looks at me and she's like, it looks like an abscess to me. She thinks I'm a heroin addict. And basically the only reason I'm there is to get opiates. Sometimes you might want to read my records before you come and assume something.
One of the nurses that worked with my physician here in Colorado, and I remember she said, when I started telling her about some of the things that were going on, and she said, I'm really worried about you, is what she told me. She says, I'm really worried that this could be something serious, And even I didn't even think at that time, but she was right on the money.
I would just say to the people out there that are going to be dealing with veterans, try to get more information. Try to maybe have your information talk about, were you in the service? What did you do? Do you have any things happen to you that bother you to this day?